Dr. Angela McKaye, chiropractor and naturopathic physician, and this month of November we are talking about men's health. This week in particular we're going to talk about testicular health, and I want to talk to you a little bit about testicular cancer. So even if you're a woman, listen up, because this may affect somebody that you know and care about. Testicular cancer is very rare. It got a lot of press because Lance Armstrong had a struggle with testicular cancer, and so he's shone a light on that and brought some attention to the issue, but it is very rare. And even Lance Armstrong, you know, I read his biography, it's been a while, but he said that he let it go until the tumor was about the size of a grapefruit, which seems crazy to me. Why would you let that happen? I think in his case it may have been some irritation from sitting on the bike seats frequently may have created some inflammation and irritation in the area too that may have led to some of that. So I want to emphasize this is something that you should be aware of, but not something you really need to fear. Just making sure that you're checking frequently and taking care of yourself, and that you report anything unusual to your doctor as soon as possible, because it's true with any cancer that if you catch it early, the treatment and the prognosis is way better the sooner you catch it. And testicular cancer often is pretty well treated, even if it's caught later, but always with cancer you want to catch it early. The mean ages of men who are affected by testicular cancer is from the age of 15 to about the age of 35. Now that's the most common age range, but it can happen at any time. And this is important to let your sons know or young men know about this so that they can be alerted to it, because most young men think that they're invincible and nothing's going to happen to them and they're going to be healthy, and they just take that for granted. So this is an important way to start emphasizing self-care, I think, for young men. For parents out there who have sons, whether you're a mom or a dad, and it can feel a little awkward the first time, and your kids might groan. My kid's always grown, but being open to talk about just basic health information is really important for them to feel comfortable with their body and to be able to alert you or their doctor if something's not going right. But this is really just teaching them good self-care and how to take care of their health, and their genital health is as important as their fighting off colds or flu, or their musculoskeletal health, or their mental health. And so this is something that's important to talk about with your kids in terms of how to take care of just their general well-being, and when to check in with their doctor, and know how to do the basics of like nutrition and sleep, and doing your self-checks to make sure that you're healthy. So the symptoms of testicular cancer are a painless lump or enlargement in either testicle, a heavy feeling in the scrotum, a dull ache in the scrotum, or groin pain or swelling, sudden collection of fluid suddenly in the scrotum, and possibly shrinkage of a testicle, and then pain or discomfort in the testicle or scrotum, and then enlargement or tenderness of the breast tissue, and also low back pain. Those are all common. You may also find enlargement of the lymph nodes in the groin, where the immune system is trying to handle the cancer. Some of them are very vague symptoms. So if you have one or more of those symptoms, please don't just automatically assume that you have testicular cancer. Go get it checked out, but don't be super fearful, because there are other things that can cause that. More often than not, it is something else. So it may be awkward to make an appointment to go talk about your genitalia with your doctor, but once you get over that initial awkward thing, doctors don't care. It's just another body part, and it's our job to take care of you. So once you get over that initial weird feeling, it's fine. No big deal. Just get it looked at and then move on with life. Risk factors for testicular cancer are if you've ever had an undescended testicle, and so that happens sometimes with men as infants, where the testes start out in the abdomen, and then with development they descend into the scrotum and outside the body. A lot of times this happens with infants, and then it'll descend on its own, and the doctor your pediatrician will just check for that, and it'll just happen over time within the first 3 to 6 months of life. And if not, then they'll often do surgery to help the testes descend, and that usually is not very much of a problem. It raises the risk of testicular cancer only very slightly, because even with men who've had that issue as an infant, the risk of testicular cancer is still incredibly low. Other things that increase your risk of testicular cancer are genetic alterations, like Klinefelter's. And so Klinefelter's is you have 3 sex chromosomes, and you may not notice this early on, but you might notice it in a kid just as they're approaching puberty. So that raises the risk of testicular cancer a little bit. We don't really know what causes testicular cancer, so it's a little bit tough for me to say what prevention measures you should take. In general, I'm always going to say that a well-rounded whole foods diet with lots of fruits and vegetables and fiber is going to be preventive for cancer. Something like the Mediterranean diet or a paleo diet, or just eating a well-rounded whole foods diet is just generally all type of cancer prevention. And so for Tactical Thursday, what I want to talk about is doing a testicular self-exam. So not all doctors recommend testicular self-examinations, but it only takes a couple minutes and you only have to do it once a month. And it's a really good way to get to know what your body is like in its normal state so that you can be aware as soon as possible if something changes. It's really not unlike women's self-breast exams, which should be done monthly as well and are a really good way to keep track of things and detect cancer early if it should appear. Now, we've talked about the fact that testicular cancer is really rare, but the self-exam is really simple, and it honestly takes only just 2 to 3 minutes. You can do it in the shower on the first of the month every month and get to know your body and what's normal. Testicular Cancer Awareness Foundation has a self-exam picture with a step-by-step process of how to do it, and it's not difficult at all. And like I said, only a couple of minutes, and then you're done. I will say that when you are doing the exam for yourself, there's some things just I want to let you know ahead of time so that if you go through this process, you're looking at the handout and graphic, you can understand what's normal. So I don't want you first time through to go, is this normal? Is this not normal? So if you are going to examine the testicles, you just need, the thumb and maybe 1 or 2 fingers, your index and middle finger, and then you're just going to very gently palpate around the testicle. And the epididymis, which is a bit of a lumpy organ in and of itself, is a small little lumpy thing that sits usually around on the top of the testicle. So some men the first time through might think that because it's a little bit firmer, it's a little bit lumpy feeling in texture, that is something concerning, and it's not. So I just want to alert you to that and let you know that is normal. So not a big deal when you're doing that. Otherwise, check through the graphic handout and follow along, and you'll be all set just to make sure that everything is going well. So what you're looking for here is just any unusual lumps, bumps. Obviously, you're going to be very gentle while you're doing this process, and you just want to feel like, what is the texture? Is it even all the way through? Is it smooth except for the epididymis, or is there something hard or lumpy in there that shouldn't be there? Is there any unusual swelling? Is it really painful? You're looking for nice, smooth, healthy tissue. It's not a big area. It doesn't take very long. You can just palpate, and then move on to the other side. Same thing, and then you're done. So we talked before about how we don't really know exactly what causes testicular cancer, but it does start in the cells that manufacture sperm. That whole process really relies on zinc, so making sure that you're eating a diet that has zinc-rich foods in it. One such food is Brazil nuts can be really helpful, and you only need a couple a day. But making sure that you're overall eating a healthful diet is the #1 way to take a stand against cancer. So making sure that you're eating several servings of fruit and vegetable per day, eating all the colors of the rainbow, and really having a well-rounded whole foods diet that's low in simple carbohydrates and sugars, and really making sure that you're making the most out of your nutrition. And that can be really fun. There's lots of really great food that is whole food that hopefully can be fun to experiment with different recipes. And the other things that are important too are managing stress, getting good sleep, having good relationships. All of those things have been shown to be helpful in cancer prevention or recovering from cancer. So I don't have any one specific supplement this week, but I will tell you that I will always pick food over supplements or pills whenever that's possible. So making sure that you've got a nice clean diet can be really helpful, and that is my favorite tip for this week. Thanks again, and send us an email or leave a comment down below if you have any questions or comments.